Hello everybody. Today I'm going to discuss about a problem of the kid is called nosebleed. Nosebleed, a common childhood condition and are normally self-limiting. It is most commonly caused by minor injury to the nose lining such as nose pricking, but can also be caused if your child has a recent cough, runny nose, viral upper respiratory tract infection, if they have allergic rhinitis or a foreign body in the nasal passage. Only very rarely can it be due to a bleeding disorder. The bleeding is usually from the front part of the nose, and while the amount of bleeding may seem like a lot, such as soaking through tissues. It is rare for child to lose so much blood that it cause any problem, such as anemia. This is only to be likely with frequent heavy nosebleed for several months and weeks that may result in some of the problem like anemia. So, most important thing you have to know what you will do if your child is, bleeding, child has bleeding in the nose. So, I am going to today tell you some of the important aspect where your child needs immediate attention, or you may contact your practitioner, general practitioner, or you may take care of your child at home. So, red signs that what you have to see in your child. If your child is taking in medication that prevents clot, many of the medication for different condition they are prescribed, and if your child less than 2 years old, and if nose bleeding is ongoing for more than 30 minutes despite appropriate first aid, if it is coming from both nostril, so it can be due to bleeding from back of the nasal pathway. If despite sitting your body upright and getting them to lean forward, they are choking on blood, suggest that is from back passage, in the nasal back passage. If child has significant disfigurement of the nose for the injury of the nose, then immediately you have to take your child to emergency department or call 999. And of course, you have to continue to do some first aid, I will mention. Now, if those red signs are not there, but you can see that there is a discharge from the nose along the side of that nosebleed, maybe there is some foreign body. If child is frequent small volume nosebleed that respond to fast aid. If child has nosebleed and bruised skin anywhere else in the body and family has some bleeding disorder, in that case you can contact your general practitioner or call NHS area 111 and start first aid in the same time. Now, if I have mentioned those features are not there, then you can take care of your child at home. But if it continues to bleed or you are worried, definitely you need to, call your general practitioner, or if the red features appear, you have to take to emergency department. Now, what are the first aid? Apply a continuous pressure for 20 minutes in the fleshy part of the nose by pinching in between index finger and thumb like this. Keep the child sitting up and leaning forward, breathing through their mouth. So they can breathe like this. Encourage them not to swallow blood but spit it out, as if they swallow the blood, that can cause vomit, which can then trigger the nose to bleed further. Keep talking to a child with reassurance and keep them as calm as possible. It is tempting to release the pressure from the nose to check if the bleeding has stopped. Please don't do that. Just continue to give pressure for 20 minutes. If there is ice available, you can also, your child can suck during that time, or an ice pack can be placed on the forehead or the nape of their neck. Giving them a cool drink can also cool them down. If there is ongoing bleeding, recheck the position of the pressure, that is correct or not. And for further 10 minutes, you can um, try. If that time ongoing bleeding is there, then continue the first aid, but call also ambulance. So these are the small talking. So just press like this, your nose, and it will help to stop the bleeding. I think this is the small talk. It will help. And if there is bleeding stopped, first aid measure applied, then next 24 hours, not to prick or blow the nose. Undertake restful, quiet activities like reading or drawing. Avoid hot bath, showers, warming. To prevent further nosebleed, your child nose is dry and cracked, petroleum jelly is good, and twice daily is good for at least a week. This can be done by cotton tip or finger, gently rubbing it on the inside of the nose. Do not use the method in children under 4 years of age. Unlikely they will cooperate or sit still. If your child suffering from constipation, increasing fluid intake and fiber in their diet, and you can ask your doctor or pharmacist to give some stool stopper to prevent them from straining. So these are all about a bit of nose bleeding. Hope this helped, and we will talk about something else next week. Bye for today.